Okay, so today we're watching a retreatment. It's a lower mandibular molar. This is a previously treated tooth that it has a fiber post going into the distal canal. So we're just going to start by making an access, and we're gonna prepare a conventional access, and sort of ignore the post. Just try to expose the gutta-percha, identify where the canals are, and we're just going to be trimming the post down all the way to the level of the pulpal floor. So you're watching the access prep right now. We're going to be skipping and fast forwarding through this part a little bit. I do think that the access is one of the most important things. You need to be able to see what you're doing, and it's very important that you don't remove too much tooth structure. In this case, you have quite a little bit of freedom because you can trim back as much as of the resin as you want. If you can make the access larger, you're not really removing any tooth structure. You really want to make sure that you can see your anatomy clearly. So we're starting to see the two mesial canals. And you can start to see the pulpal floor, that anatomical groove connecting the two mesial canals. And then there's your fiber post on the distal. In this case, it's looking pretty dark in contrast to the resin. So we're just going to keep removing a little bit of the resin.
So I'm going to remove this post first. I see a little gap. Oh, we forgot the retreat.
So I think at this point the access is starting to look pretty good. You can clearly see all the canals, and I don't think anything is covered. Right, if you look on the screen, right to the right of the post, there's a little gap, which is a void in the cement that's holding the post in place. So I'm going to use a little file, a 6 or an 8, and see if I can carefully wiggle it down alongside the post. And so we're just using a back and forth motion. So very gently back and forth, rotating about 25 degrees in each direction. And then slight apical pressure. So apical pressure, and then as it starts to bind, you can start to move it up and down. So you put some apical pressure, and then twisting back and forth. You can pull coronally, and then just go back and forth to create a little bit of space alongside the post. And a lot of times the distal canal has a bit of an oval shape and the post is round, so we're using this to our advantage. It doesn't always work. I think we got lucky in this case. Now, if you can't sneak a file beside the post, that's okay. There's other ways to remove it. But you can see it was actually pretty quick, and now we're pretty much to the working length. So we've gone alongside the post and through the apical portion of the gutta-percha. And I'm using a 6C file right now. C files are better at cutting through material, so it's easier in this type of a situation.
So can I have some short rotaries for now?
You can also put a little bit of chloroform in the pulp chamber. Chloroform would make it a little bit easier for the C files to penetrate apically. The downside is that sometimes it just makes a mess, and it makes things more difficult to see. But I didn't need it this time, but normally I probably would put some. So next we're going to start to use some rotary files and just enlarge that space a little bit more. So I would probably start with a 35 rotary. Just it's strong enough that you're not worried about breakage, and pretty efficient.
Okay, can I have the touch and heat, please?
So now that we've got a little bit of space, I'm going to focus on the other canals for a little bit. And when I retreat a root canal, the first thing I do is use a touch and heat and see if I can remove a little bit of the coronal portion of the Gutta-percha. Now this isn't mandatory, there are other ways of doing it, but for me this is just a quick and easy way to remove about 3 to 5 millimeters of Gutta-percha. There you go, nice and easy. Now what I would do next is I would flood the chamber with chloroform and sort of agitate it with my Endo Explorer. So you're going to see here.
Let's grab a little bit of retreat solution.
So there's the space that I created. Okay, so very carefully, we're just adding a drop or 2 drops of chloroform into the pulp chamber. And so chloroform is great. It works really well at dissolving the material, but it only works if it's in direct contact with the Gutta-percha. So here's what I'm doing. I'm sort of agitating the chloroform and making sure it goes into contact with the Gutta-percha. And sometimes this is all you need to do, and you can start to work your way down the canal. Now, I typically don't use any rotaries to remove Gutta-percha initially, so I will work my way down to working length with either a 10 C file or an 8 C file. And there you go. So once I've achieved patency on the canals, I can start to use a rotary. And it's just it's just pulling out Gutta-percha. Now there's still chloroform in the canal. You have to make sure you keep topping it up. You need to have a good amount of chloroform in there. But be very careful not to spill over and melt the rubber dam. So, just confirming the working lengths. You'll have to excuse my apex locator, the disinfectant that we've been using sort of melted away a layer of the screen there. I think I fixed it though. I brought it home last week and used a polishing wheel and made it nice and clean again. So the next video is going to be nice and clear. So there you go. We're at length in one of the mesial canals. I'm not really sure which one we're in right now, but you just repeat the process for the other one. So there you go, 20 millimeters. We'll try the lingual as well. So when using the apex locator, the most accurate measurement is at the bottom of the green. So what I'd like to do is pass through the apex slightly by half a millimeter or so, and then gently pull back on the file until my reading is right at the bottom of the green, so right there. So that is an accurate reading, and then I'll take that reading, it's probably 20 millimeters or so, and then I'll subtract half a millimeter, and from then on every file that I use is to 19 and a half. And right before I obturate, I go back one more time, and next time we use a different file to measure, but we just confirm the lengths at the end right before we're ready to obturate, and then we fill.
Okay.
So in this case, it was a retreatment. So I've given her 2 blocks. Her lip is numb. All signs are good. I think we've achieved anesthesia. But as I was working, she could start to feel it a little bit, especially as I got near the working length on the distal canal. So we're going to take a break, take the rubber dam off quickly, and administer an X-tip. So at this point, we've confirmed the working lengths. The canals are not clean yet, but we're patent on all the canals, I think. So we're going to start to use rotary files and just remove some of the bulk of the Gutta-percha that remains on the walls of the canals. I'll use a smaller file first, so a 2504, to my working length minus half a millimeter. And I'll do that usually to all the canals just to make sure that we've got a nice glide path and that we can get down to the bottom repeatedly. So I'm doing the same on the distal here. So even though the post is not removed, I can still get around the post with a rotary file pretty much to the working length. And what this is doing is just creating a little bit of room, and you're going to see later, what this does is it really defines your anatomy. So you begin to really see where the post is and to see a difference between the fiber post and the dentin. So there's my post. I'm just checking to see if it's mobile at all. In this case, it's not. But the nice thing about Fiberpost is that they break up pretty easily. Once you start to use an ultrasonic, it'll fall apart. So there you go. You can see my post and the little space that I created.
Yeah, so let's see if we can get the post out now.
We're going to switch over to ultrasonics. So I'm using a one of the Buchanan tips. And I have the energy sort of set to about 50% at this point, and I'm using very short bursts. I don't want to create too much heat, so I would only use it for 1 or 2 seconds at a time, and then rinse with some liquid. Sodium hypochlorite is really nice here because it just makes everything nice and clear, and you can see your post and you can see the dentin. So now the post is starting to look a little bit dark. So the dark area is the carbon fiber post, and then there you go. Vibrate for 2 seconds. Use hypo. So I've cut out a lot of parts, but the post removal I didn't. So this is it. So you'll see it only takes about 3 minutes to remove. For this kind of a case, I would use either a buck 1 or a buck 3 tip, depending on how far into the canal I'm working. So you can start with a larger, thicker tip first, and then switch to a skinnier one as you go along. So you can really see the post falling apart now, and you can see the fibers breaking apart. Again, only a couple seconds. And then bleach. I may have turned the intensity down a little bit. Especially if you're working with a skinnier ultrasonic file, you want to make sure you keep the power low, otherwise it will break. So I really can't emphasize enough that you need to keep this cool. You can't let it heat up. Otherwise, you're gonna cause problems, and you're gonna cause post-operative pain. So yeah, so very short bursts with the ultrasonic, and lots of irrigation. Now fiber posts are pretty easy to remove if you go slowly and you have the proper ultrasonic tip. You should be able to break it apart into pieces and flush it out with the irrigating solution.
Maybe explore for a second.
The other thing to keep in mind with ultrasonic tips is you have to make sure that you're only running the ultrasonic when it's in contact with the dentin or the fiber post or something inside of the tooth. If you run it, if you step on the pedal and it's not touching anything, you're going to break the tip. It's just going to fracture on you. And there you go. We're starting to see some of the Gutta-percha there. Okay, so the post is out, and now we're just going to go through our steps. We're going to remove the apical portion of material that remains in the canal here. We're going to make sure that we've got the correct lengths. We're going to confirm, remeasure everything one more time, and obturate. So for whatever reason, as I was getting down to the apex on the distal canal, my patient could feel it a little bit. Now, this isn't always a bad thing because, you know, they can give you some feedback and let you know that you're creating heat with the ultrasonic tip. And so I typically don't want to have people really frozen when I'm retreating a tooth. But in this case, I needed to add a little more supplemental anesthesia. So we're going to do an X-tip injection in the retromolar area. So this is the easiest spot if there is no third molar, and it works really well. So there you go, the cannula's in. Now we're using carbocaine 3% without epinephrine here. You want to avoid epinephrine when you're giving an intraosseous injection, otherwise the patient will experience a rapid heart rate and will become anxious. And if you notice, there was a stopper on the short needle that comes with the X-tip, and this is just to prevent backflow of anesthetic into the patient's mouth. So we're using a hemostat to remove. Okay, very carefully. Make sure you don't drop it. There we go. Let's continue. So all things considered, the X-tip anesthesia was very quick. It didn't take very long. It's nice and easy and quick to do, and it really gets you out of a jam when you're having problems. We use it almost every day in our office. Just confirming the length on the distal canal here.
How are you doing? Any feeling?
And just like that, we're able to get down to the apex, and she's not feeling it anymore. So great, X-tip worked.
We're going to confirm at the end.
So now I've got hypochlorite in the canal. We're no longer using chloroform, so we're using rotary instruments to pull out whatever material remains in the canal. And at this point, all my rotary instruments are stopping about 0.5 millimeter short of the working length. So lots of irrigation. So I'm using sequentially larger files. I started with a 2504 and worked my way up to a 4004. I'd probably, finish with a 45 on the distal and 40s on the mesial for a retreatment. And you can also see a mid-mesial canal here that we found. And I think it joins up with the mesiolingual canal, if I'm not mistaken. Just confirming patency. So one of the mesials, I think at this point, one of the mesial canals was not fully instrumented previously, so the canal was a little bit tight, so we're just going to use a C file and enlarge the canal slightly near the apex. Okay, enough of that. Let's move on. So next, I think we're going to be confirming the working length. So I learned this technique from my partner, Ted. So basically, we're using a path file. This is a number 10 path file. And the apex locator clips directly onto the part of the path file that goes into the handpiece. This is a great technique. This file reads much better than any K file that I've used. It just gives you a smooth and clear reading. So for this part where we're just confirming the lengths and we're almost ready to fill the canals, this is a great technique. So you hook the file onto the clip of the apex locator, and we go into every canal one by one. You don't need a stopper, so what you do is you put the file in, and then you set your mirror such that you can line up those markings on the file with your cusp, and you advance the path file apically into the red, and you do the same thing. You pull back and you get a nice reading.
Yes.
This is my favorite part of the video. Just going really, really fast, cleaning up the access. So I just don't want to have any gutta-percha on the walls. Just making sure the pulpal floor is clean before we start fitting the cone. So there we go. Canals are cleaned. Pulp chamber is clean. Now we can start fitting our cones. And this couldn't be easier because we've prepped the canals now with a 0.04 taper. We grab a corresponding 0.04 taper gutta-percha point. I usually find that we have to use one size smaller than my last files. So in this case, I used the 40 rotary on the mesial, so I'm using a 35 gutta-percha point. And all I do is seat the file into the canal all the way down to the bottom. Then I carefully pick it up at the reference point. So I use my mirror right there and I grab it at the reference point. And I have a ruler on the back of my mirror, and I check what my length is. And if I am, here we go, final irrigation. And then I cut the gutta-percha points as necessary, and I repeat for every canal. So we're doing the final irrigation. We're gonna talk about that in another video, but for now, cleaning, drying the canals really well. I used a endo activator to activate the solutions. Cones are fit, and we put them back into the tooth with sealer. This is the alpha unit from B&L, similar to the touch and heat, and it just sears off the gutta-percha. I like to fill the canals one by one. I just find that if you put more than one cone in there at a time, things get a little bit messy and confusing. So dip the cone in sealer, put it into the canal. Now I don't know if you can see, but there's actually a little crimp mark on the side of the cone, and I line this. The crimp mark is just there to make sure that I've seated my cone fully. So again, sear off the gutta-percha and down pack. And repeat. So the distal has been
30 cone.
sealed, the mesials have been sealed, and all that's left to do is the mid-mesial, which joins up somewhere along the way with the mesiolingual canal, I believe. And so we're just going to fit a cone until we come into contact with the existing cone in the mesiolingual canal. And sear it off. So there we go. We've completed the down pack. 3 mesials and 1 distal. And this is the beta unit from BNL. And I think it's heating the gutta-percha to about 200 degrees. And I'm just injecting gutta-percha into the coronal portion of the 3 mesial canals. And we're going to prepare a post space in the distal canal. So, yeah, we're going to use a Gates glidden and a Fiberpost drill, and just make our way down to about 15 millimeters and leave a nice clear post space there for the post and core.
Yeah, okay. Yeah. Just a post, 3 gates and a post. Yellow. Okay, root canal's finished. Okay, we're just gonna close things up real quick here and you're done, okay?
So we're going to speed up through this last little bit. We're going to use a little cotton pellet with some alcohol and clean up the access, remove the sealer from the walls. And I usually leave 1 or 2 cotton pellets in, and we use a material called Temrex for the temporary filling. We'll take off the rubber dam, verify occlusion, and take our final x-ray. And this is our final x-ray. Thank you for watching, and if you have any questions or comments, please give me a shout.